Sex is not a bad thing, but it can be used to do bad things. It can also be a bad time for you to be having sex.
No. I had the worst sexual irritation from my mom. My mom scared me.
The issue with condom is that we are not sure of the consistent and correct use.
Sex has evolved over time.
There's nothing new under the sun. The Kama Sutra is an old book.
I know, right?
The Kama Sutra is an old book.
Hello everyone, welcome to another exciting episode of the Medics Talk podcast, proudly brought to you by Swift Medics Healthcare. Today, we have a very important topic to dissect and penetrate: navigating intimacy, unveiling truths and myths in sexual health. And today, to sail that ship with me is the delectable Dr. Hauwa.
Thank you, Dr. Kalu. I have two amazing guests here. Delectable, if I may say. So on our left is Dr. Njoku Amarachukwu. Is a renowned obstetrician and then gynecologist. And then on my right, we have the AMVCA award-winning actress, Eku Edewor.
Whoa, awesome.
I'm producer.
I'm producer.
Let's go. Yeah.
Before we forget, she is an award-winning producer too.
Yes, so.
Oh, yes. So, welcome. Thank you for honoring us.
Thank you
for
having us.
Yeah. Excited to be here.
Amazing. So today we're going to be...
Let's talk about sex.
Yeah, we're talking about sex.
So we are talking about sex.
Yeah, we want to address prevalent misconceptions, because in town everybody's talking about, this is what you should do, that's the best practice, this is how to do it best, everybody's their own doctor, everybody has something to say, but I think we as professionals, that's where we come in to try and bridge that gap. So to kick off, I'd like to ask Ms. Eku, what do you think healthcare providers should do to effectively counsel patients on family planning methods, taking into account individual preferences and circumstances?
So I think that sexual health education should start quite young. And I do think that, and I don't know how it would work, medical institutions, especially if they're private ones that are able to have access to lots of schools, should try and partner with more schools as part of their outreach, or maybe part of their hospital plans or whatever, to partner with schools to give sex education. And obviously at different ages you'll know how to temper that information. I just remembered that when I think about this type of sexual education I had, the first class I had was probably in secondary school, and the information was very, very poor. It was more about scaring us than actually giving information that was worth having. And I do know that when I was at school, there were children other young girls that had started sexual activity from age 9, 10, which is very young, but it was happening and those discussions were happening. So I do think that there's a way that it can be introduced in a way, whether that is by providing an anonymous hotline that kids can call, because obviously parents are a big part of that scaremongering as well. Not feeling that if you go and talk to them about sex, that kids will start having sex. You know what I mean?
I had the worst sexual irritation from my mom. My mom scared me. Immediately I saw my period, of course, the first thing I'll do is call my mom. Oh, Mom, I was testing my period. And she was like,
don't touch any man.
If you touch any man, that will be the end of your education. You will get pregnant. It's over for you. So that was what we got, and we were scared. It worked. It worked for the first 3 years, but then...
It doesn't work for everyone.
It worked for me for the first 3 years. I was so scared of men. Yeah. Don't touch me. I could get physical. You want to destroy my life. But after that, it didn't work again. So, we need to really talk about these things.
I remember that in one of the classes that we had, they were showing us the worst case scenario of possibly contracting an STI. And I was saying to doctor that they literally showed a man's amputated penis as one of the case studies. And I don't know, it was the long-term effect of maybe getting gonorrhea or something. Or just I don't know.
How old were you then?
Maybe 12, maybe 11, 12. It was at secondary school, but it was kind of more handled in biology class type of way of, it didn't even have anything to do with the intimacy part, I guess, of having these type of relationships. It was more if this happens, this is where you could end up with an amputated penis. And I don't know what guys thought about that class. I remember when you go on Google and you you Google like a disease and they show you the worst tumors. That was like the picture. It was horrific, and I was like, "Yee, this is horrible." So I don't think I learned anything about sexual health practices from that. I just more avoid totally, or you could die from disease. You know?
Yeah, I think for a guy, you know, if I was in that class at 12, seeing somebody have their penis cut off, and I didn't know anything about sex, or maybe I just saw things in the movies, I'd be like, Omo, is it like, how did they do it? What was the, and you know, then nobody wanted to talk about the act of sex.
Yeah.
You know, you didn't even know what was really happening. That was sex. But they just tell you if you go close to a girl or if you go close to a man. But how do you mean go close to a girl? Is it like touching her clothes or just, you know, passing by where she lives? Or like, how do you mean go close? They didn't explain those details. I think now, like what you said, we should be able to like incorporate it and make sure that, okay, they even understand how the process. And then, you know, we now talk about, oh yeah, but with this process, these are things that could go wrong. STIs, you know, pregnancy, you know, it's a whole lot. Dr. Njoku is a gynecologist, so I'm sure he sees a whole lot.
If I may come in, the education is important. Telling them this is the act of sex and this is how the biology works. Then also telling them what you can do. Because at that age, they are so exuberant and explorative, you can't really be sure that they are not doing the acts.
Mm-hmm.
You can also tell them, okay, what are the safe sex practices you can do? If you find yourself in that act, that's where contraception comes in.
Mm-hmm.
Because in this part of the world, there's a lot of stigmatization about
Oh my
contraception. Parents telling their children about contraception. Some believe that it's a form of encouraging them.
Mm-hmm.
Yeah, but we need to change that orientation.
True.
Yeah, because you can't really prevent them from doing the act. So when you done your part as a parent counseling them, you also tell them about the safe practices, which is abstinence and contraception. That's where the contraceptive advice, especially for us as health workers, comes in. So we need to give that orientation to parents that, educate your children, but also discuss this as an option. But in this part of the world, there's a lot of stigmatization. How can a mother give a child contraception? How can a mother take a child to a contraceptive
when
clinic?
It comes to the misconceptions of emergency contraceptives. Like people pop it like it's Panadol.
Do you know, to be honest, so I've been educated in I was educated here till I was about 13, and then I was educated in the UK. And the education about sexual health and practices is so much more advanced and in those countries, because obviously they recognize how much of a strain that venereal diseases and all these kind of things do impact society, and we don't seem to consider that aspect of it. And also, like Dr. Njoku was saying, that even you can't stop some kids, so you should arm them with correct information.
Yes.
So I was surprised that there was some women, and I say women because they're in their 20s, that still believe some really strange ideas about emergency contraception. I read someone's blog that said that she used the salt water method, so drinking salt water after having sex. And I was like, logically, how do you think that affects your vagina? Like, how is your stomach connected
Some people
to you?
think their body is a machine. In, out.
That you're
Everything
flushing,
goes
like
in.
you're flushing. The water is good to
I'm
flush.
telling you.
I was like, is it coming out of your vagina, the salt water?
Yeah,
I'm
there's
confused.
a very
Because but she said it that was her contraceptive method, and this is somebody in her 20s. I was shocked that they considered that an emergency form of contraception.
There's another one, like I heard somebody say
It does not work, by the way. Sorry, let's just say it doesn't work.
Of course,
It
it doesn't work. It doesn't work. It doesn't work at all.
Well, one thing about contraception, it has evolved over the years. If you study contraception, there is some traditional method that they use over the years, and there are the modern or orthodox method that research have shown to be effective. Some of them are effective almost 100%. So, we should arm them with correct information in terms of what works and what doesn't work, and we also should embrace changes in terms of.
Thank you so much, Dr. Njoku.
Thank you so much.
Yeah.
Thank you so much, Dr. Njoku. Another thing that we haven't really touched since we've been talking is that we've talked about emergency contraceptive, but we've not really spoken about the most common contraceptive. Now, the most common contraceptive when we were growing up, because I'm a millennial, so when we're growing up, the most common contraceptive was a condom. But now I see a lot of things going on online that I don't understand. People using antibiotics as a form of contraceptive.
Yeah, these are all the misconceptions. Ampiclox. Somebody told me.
Ampiclox, yes, I
know
heard.
that. Just once I'm done, I'll just pop a pill. Probably somebody told her because they thought it would be prophylaxis for infection, but she thought it was going to serve as a contraceptive. So she was doing it
I've literally
for
had
the
somebody
wrong
swear to
reason.
me that it works.
I mean, even the fact that they're abusing antibiotics is crazy to me. Like,
Yeah. Speaking from a medical point of view, you say something that the commonest contraceptives is condom, bro. The issue with condom is that we are not sure of the consistent and correct use. So when we are not applying the contraceptive consistently and correctly, the failure rate is high. That's why people come with unwanted pregnancy, STIs, and the rest. So where we now talk about double protection comes in. So condom and another method of contraception. Because sometimes, like teenagers, you can be high and probably urgency of the moment and everything. You forget to put on the condom correctly. So condom is good because it has double protection. It protects both against STIs and against pregnancy. But it's not the consistency and correct application is not guaranteed. That's why this other method comes in, like the emergency contraception, other forms of contraception. We have the implants that can stay up to 5 years. We have the injectable that you do 2 monthly.
Okay, so I'll just say, for instance,
pills,
let's say we wanted to combine contraceptives, because that's what you're encouraging, that to ensure the efficacy, because most contraceptives have about 90% or less, on their own. But you're saying if we can combine two methods, we're getting as almost 99%. Is that what you?
Yeah. Actually, one thing about contraception is personalized. It's individualized. It's not like a one car fit all. It's personalized based on what you want to achieve. For teenagers, especially what is happening with the prevalence of STIs, whatever method you use, barrier method should be there, and they should be educated on correct and consistent use of that barrier method. But since it's not, the failure rate is high. That's why we can combine it with other things like pills. Yeah, in case the barrier method wasn't correctly and consistently applied.
Thank you.
So the risk of unwanted pregnancy is further reduced.
So I have one question.
Okay.
I've always, it was always said to me that the emergency pill, like the morning after pill, was only ever supposed to be used in emergency situations and shouldn't be used as a consistent form of contraception, because so what they used to say was that it could really affect your fertility because it's very strong, and that sort of. But instead, if you know that you're going to be having regular sexual activity, you should just be on the pill and take a daily pill,
just to suppress.
Because I heard that here everyone considers stuff like personal something that as a form of, like, basically like taking the pill.
One thing about he said that if a woman takes an emergency pill 3 times in a month or twice in a month, she actually needs another method, a more consistent method, like a monthly pill or an injectable or an implant.
But sir, the public, like from what I've heard from my patients say to me, they say it's not so easy for single girls to get contraceptive from the hospital. They want to get contraceptive,
the pills,
but they don't feel like the hospitals are accessible for them to get it, so they just take the emergency pills that they see.
But so it's bad to take. So the question is, it's bad to take emergency
pill.
pills
It is
regularly.
bad. Yes.
No, emergency pill, I wouldn't say it's bad. What I will say is that it has a window of effectiveness.
Yeah.
It should be taken within the first 3 days. Or
72 hours. Yeah.
Okay, but
and the later you take it,
yeah,
the less effective it is.
But the impact it has on your system is no worse or less than taking pills.
It doesn't affect fertility.
Like 14, was it 21 day
No,
pill?
it just moves it. It just moves.
It doesn't affect fertility.
Okay.
It's actually a myth. It doesn't affect fertility.
Okay.
But the issue is the effectiveness, especially when you don't take it immediately. And its hormones, it has progesterone, so it can affect the menstrual pattern. It can alter the menstrual pattern. But it doesn't affect the fertility. But the main thing is there is the effectiveness if you don't take it on time.
Then
And if you need to
risk.
take it repeatedly.
Risk of pregnancies.
The HPV diagnostic kit is comprehensive, covers 18 high-risk types, easy operation, 3 steps to finish testing, a rapid result. With Biotech, the mobile HPV testing solution, always access to you.
So currently we're vaccinating just girls with the HPV vaccine. There's a school of thought that says the boys should also get the vaccines. What are your thoughts on that?
Okay. Human papillomavirus, we know, is the causative organism for cervical cancer. And in guys, it can also cause perineal cancer, the cancer of the penis. But cervical cancer is commoner for that. It depends on the country policy. Some country vaccinate both male and female. I think Australia does that. In our country, we are battling with other things like screening, or even women in the reproductive age screening, and which we don't have a consistent or a formulated regularized screening method. That's why it ranks among the commonest cancer in our environment, second to breast cancer, cervical cancer. But this cancer is one of the cancer that is completely preventable. So prevention is the key here. And the prevention is one, vaccination of these girls. Vaccination of guys can also help prevent cervical cancer. It can help prevent the perineal cancer in male and cervical cancer in female, because it's a cancer that the human papillomavirus infection can be transmitted during sexual intercourse.
So you think our country should revise the policy of vaccinating just girls?
Yeah, vaccinating guys, boys will also help.
Good, because currently I think we just do girls.
They just do
Most children's centers I know, we only focus on the girls. So that's something we need to put out there, because I think the whole essence of this is not just to discuss amongst ourselves, but to also see how we can get, like we said initially, that we're trying to get the healthcare generally in the country to a level where it can compete with other countries. Like you said, Australia is already implementing it. If we think that this is something that works, then we should also push for, our country to begin to think about, okay, you know what, the boys should also get these things too.
Just I say, it's a policy thing, but it's just more than vaccination is one of the key points of prevention. Then screening,
Pap smears.
routine screening, pap smear, pre-early for women reproductive age is another very important key point, because vaccination, once a girl child has started sexual activity, the vaccination is no more effective. Because once it is presumed that he has already contacted the HPV. So vaccination is no more effective. At that point, the target is to screen, do pap smear early to see whether there's what we call the premalignant lesion. It's not the cancer, it's just a lesion that is treatable. To find it and treat. So people that have not started sexual activity is where the vaccine
works best.
So it's actually a multifaceted approach. Vaccination is
preventing,
there, screening is there.
True.
Then early treatment also is also there.
Yeah, catching it early. We need to catch these things early.
We should look at the policy to target each and every aspect of this prevention.
Amazing. What do you think about genital mutilation, though? Like, I mean, I don't know how common it is. I know back in the day, it was a thing.
Discussion,
you know, especially the females were, because they were like, oh, if the men are getting circumcised, let's also do something. You know, I think some regions in the country used to really practice it, but I haven't heard so much about it lately. But, you know, I think this is a good medium to try and like create awareness if there are still people doing it. It's
totally barbaric.
Yeah, it's crude. You could go to hell for that, you know, so.
Because you just deprive somebody of one of the freest joy anybody can get. Like,
for the women or the men?
For the women, it's mostly genital mutilation mostly occurs in the women. I'm not saying it doesn't happen with men.
There's what?
Is circumcision not genital mutilation?
No,
it's not.
I don't think. No, it's not.
They have changed the term.
It's not.
It has been changed over the years. I think at one time it was called female circumcision, which it had been changed to mutilation, just to put out the image that is bad.
It is bad, yeah.
Because circumcision looks something acceptable.
Yes.
And anyway, if I may come in here, in our environment, there's one of the unspeak codes whereby it's sweep under the carpet is a secret. This female genital mutilation. People that do it don't talk about it, and it has a very strong cultural conviction for people doing it. Most of the people that insist it should be done are family relatives. Most times grandmothers. If you look at the research that have been done on this, those are the people that propagate it. Sometimes they feel that they did it,
so everybody
down the line should do it. And is more of a cultural belief.
No, mama. We're not doing it.
So it's something that we need to speak up, because it's usually not talked about. Even when you want to talk about it, they usually shy away.
Everybody runs away
medically,
from
it has no benefits.
No.
Medically, not the grade of mutilation. The grade 1 is to remove the clitoris. Grade 2 is to remove the labia minora. Then grade 3 is to remove the majora. Then grade 4 is any other practice that's depending on the grade. Some people may have difficulty in urination. Some people may have difficulty.
Medical relevance.
So this is
talking
impact
about medical relevance.
Has no medical
relevance.
relevance.
No, it's medical benefit.
No,
that's the question I was asking.
Rather, it has drawbacks.
A lot of consequences.
But it has massive consequences. Because obviously, with circumcision of boys, the reasoning behind circumcision of boys is like hygiene. It's hygiene because it can increase infection for boys, and it's also skin that you don't necessarily need.
But it looks better. I think it looks like
better.
I think it looks better.
But you can even still argue. You can even still argue it's a cultural preference. Do you understand? But yes,
cosmetic.
It's cosmetic because it has to look good. If she pulls it out, you're like,
no cap.
You know, it's well defined.
Well, mutilation has no benefits.
No, rather, it has consequences.
Yes, and because I hear you can get really horrible infections.
Some people during childbirth, they have to cut that mutilation for them to
have
their child.
And then the women don't enjoy sex.
The quality of life
is reduced.
Sense of sexual pleasure.
All that stuff. Speaking of which,
even the depression part of it, the quality is quite bad.
Yeah. So like you said, decrease sexual pleasure. I've heard some people. So I don't know if it's like a religious thing or they're like, oh, I don't really enjoy sex. You know, but a lot of people have to do it anyways because
of reproductive.
We have to reproduce and all that. But aside the whole thing, a lot of people find sex pleasurable, whether or not you are reproducing from sex.
But is it normal if sex is not enjoyable?
Yeah,
that's where I was going to.
You took the words right out of my mouth.
Yeah. But is it normal?
It's normal for some people. I've read that some people are asexual and they don't have sexual desire.
You think it's normal?
No, I mean that it's normal for an asexual person is what I'm saying. Like I always find the words abnormal, normal very
tricky,
very tricky words. And very judgmental. And very judgmental because I also do think that some people it takes them a while to, it depends how like you were saying, like some people feel they have to have sex. Why do you feel like you have to have sex? Do you know what I mean? Like, surely you should have sex because you want to have sex. But if you have started having sex from young because you were peer pressured into having sex and you had a bad experience, you will associate sex as like something. Or if you've been raped, for example, if you've been raped, a lot of people don't want to have sex, and then they don't know how to speak on their rape experiences. So and also sex is very psychological. It is not just so it's for guys. A lot of times it can always feel pleasurable, but for a lot of women,
it has to be the
experience of sex, it has to be it's very psychological. Right environment.
Yeah.
So I just think it's a very broad generalization to say that some people don't. I think there are lots of underlying circumstances why someone may not enjoy. And I still think it comes down to a lot of these conversations about having the right conversations with people about why sex should be employed. It shouldn't just be like, because my friend is having sex,
I should have sex. Yeah.
Or if I don't have sex, I'm not cool. Or if I haven't had sex, I'm not considered to be. Do you understand?
Yeah.
Why are you having sex?
Why are you having sex?
Everybody should find out.
Should you be having sex? Are you being responsible? Are you healthy? All these.
How are you even having sex?
Yes,
it matters a lot.
Sex is not a bad thing, but it can be used to do bad things. It can also be a bad time for you to be having sex. So I'm saying that it's more about opening up the conversations about sex positivity in the right way. Age comes into it as well, like circumstance. I'm not one of these people that's like, you must only be married. No, obviously not. But there should be a certain level of respect around the conversation. And I don't think that we respectfully approach sex as a topic in general, societally wise.
Yeah, so because is it that they are overindulging or they are being judgmental?
Yeah, or you're celebrating in a way that is just very tacky, like all these rappers and stuff about popping this, popping that. Do you know what I mean?
Like an activity. Everybody does
trivializing, stigmatizing.
But sex. Let's be honest. Sex has evolved over time. Like there are different styles that I'm like. So I don't know.
No, there's nothing new under the sun. The Kama Sutra is an old book.
I know,
the
right?
Kama Sutra is an old book.
Sometimes I feel like it's not necessarily that sex has evolved. It's that some people are now opened to showing
them having sexual practices.
Yes, so you learn from other people, and that's why now it looks like it has evolved. It's just that we just are learning some things from some people. I think so, because now there's porn.
I think if you don't have respect, I think sex is spiritual, emotional, and all these kind of things. I think if you don't have respect for that type of human interaction, then you should not be having sex. I also think that it reduces what sex is when you see like stuff like porn and all these kind of things where it now becomes this, like you said, this extravagant, crazy act that people are trying to prove.
People are now
that
different things. Yeah.
Look, it's between two people.
It's a power play. It's no longer just
I also believe in all these things when they say about spiritual exchange. You should not be sleeping with anybody.
There was one time I came across somebody asking, saying there's a best sex style. There's like you understand, like they'll tell you that there's a best position for sex.
Are you like best position for sex in terms of enjoying it, or in terms of you get a boy or a girl out of it?
Yeah, even saying
getting
that.
A boy
getting a boy out of it.
If you do doggy, I think you might get a girl.
Yes, if you do.
What medically?
That's wrong, though.
Research have not found that to be true, because when you go down to the biology, it's all about it's all about probability.
Who gets there first?
X and the Y chromosome. Which of the sperm with the X or Y chromosome fertilize the egg? Yeah.
True.
So, and the sperms are in millions. So, how can a position
you've not heard it.
affect the millions of sperm?
I'm telling you, they'll tell you there are some sex styles that you do.
You're not doing it right.
And you will know that
you're going to get a
girl.
Oh, I even heard one that there's a time of the day. Yes, I've heard that one too.
I think the only way now, and like, is by selection, like it's an expensive procedure.
IVF and
you can pick what you want. Yeah, with that you can pick what you want.
From the embryos, the one that is male and female, and transfer back.
True. Yeah. That's amazing. We've talked about a whole lot.
We've talked about a whole lot. Dr. Kalu, what do you think about today?
It's amazing. It's been amazing. Thank you so much, our amazing viewers. Thank you for joining us today as we were penetrating the topic, But these are things that we feel everybody should hear, and correct a lot of, discrepancies and myths. And, let's all come together. Like we all said, the hospitals, the schools, sex education,
Public figures.
and public figures, everybody should come together and see how we can take our country to the next level.
So if you have any questions, hit us up in the comment section and we'll answer them. And if you know any myths we are unaware of, please indulge.
Let us tell you.